Hey guys, so I wanted to just come on here and have a little bit of an honest conversation about how I'm feeling and how everything is going with my heart condition and just in general, but pretty much focusing on my heart condition because that's a pretty new thing that's going on with me. Um, so I did the echo that they wanted to do, and it pretty much just confirmed what my doctor thought was wrong with me, which was that I have something called long QT syndrome, which causes me to have arrhythmias, which can also cause sudden cardiac death. And it is possible that all the time that I have had seizures, that the seizures have been actually caused by my long QT syndrome and isn't actually epilepsy. So, this is just a lot of new information that I'm learning. If that is the truth, and my seizures are caused by my heart condition and not by epilepsy, then I just wish that it's something that they would have known way before now, because I feel like maybe it's something that we could have gotten under control um, better. Um, that maybe we could have, I don't know, changed how things have gone. So recently, I've been dealing with a lot of arrhythmias. I've been feeling palpitations a lot lately, and I've been having chest pains. And it's really scary because, as someone who isn't used to having these things go on, um, I've had them every once in a while throughout my life, which, according to my doctor, is probably indicative that this long QT syndrome has been symptomatic for a while. I just didn't really recognize it as being symptoms. And honestly, it's probably my fault because when I notice certain symptoms, I don't really just run to my doctor straight away and tell them about new symptoms that I'm experiencing. So that's kind of my fault on that aspect. But I didn't really talk to my doctors. Last year or the year before last, 2015, I was seeing a doctor who I didn't really trust, who basically just told me that my weight was the cause of all my problems. And she didn't really seem to want to listen to anything that I had to say. She just wanted to tell me to lose weight, and that was it, and everything would be fine. Um, so, of course, I didn't feel comfortable telling her about new symptoms, which is why I switched doctors. I do feel a little bit more confident talking to this new doctor about symptoms that I'm having, but I still haven't like really built a relationship with this new doctor. So it's something that I feel like maybe it will improve over time, like the longer that I'm a patient with her. But I don't know. I don't know how that's going to go, honestly. But just dealing with the chest pain and the arrhythmias and knowing that, you know, I could pass out at any time, I could have seizures at any time, which is something that I've been dealing with. And also just the arrhythmias and the chest pains and all of that stuff. It's really scary. And, I'm only 28, I'll be 29 in May. Um, it's just scary to be going through these heart problems at this age, although it does run in my family on both sides. Um, both sides of my family have a significant history of heart related issues. So, honestly, like I've said in other videos, I did kind of see heart problems coming in my future. A lot of people will say that, oh, well, you're obese, so you should have seen them coming anyway, but we will ignore you and say, screw you, because other than um, the things that are going on with my spina bifida and my long QT syndrome with, the heart condition. Um, I don't really have many issues. Of course, I have cancer. I've told you guys about that. Um, but other than that, I don't really have a lot of health issues as far as like things that are really, really scary. Um, right now, my cancer is under control. Um, at least to the point where I'm comfortable saying that it's under control. And, I'm dealing with it very, very well. And I feel like I'm just at a point where I just want everything to go back to normal. I just want to feel normal again. I just don't want to feel the pain that I'm feeling, and I just don't want to feel sick. And I've been dealing with a lot of shortness of breath lately, just walking from the couch to the kitchen, which is literally like maybe 15 steps, if that. Um, that makes me short of breath. And no, it's not a weight issue because I've still been losing weight. So, you know, I don't know what to say. I'm definitely going to be talking to my doctor about that. They've known that I've been having breathing issues since I had my gallbladder removal surgery. So I'm not sure if it was something with the anesthesia, because with heart conditions, you can be affected with certain medications. Um, and anesthesia is obviously something huge that can cause a lot of issues regardless. But especially if you have certain medical conditions, that can definitely cause issues. And I am also someone who has had trouble waking up from anesthesia in the past, so it's a little bit scary. But I'm trying to stay positive about everything, and I'm trying to just look at things and um, deal with them the best way possible. And I'm trying to keep my life as normal as possible for as long as I can. And, I'm just trying to enjoy the happiness while I can and the fun times while I can. So that's what I'm trying to do. And I guess that's pretty much all I wanted to say. Um, if you have any questions about long QT syndrome, it is much more common to hear about this in younger children than it is people of my age. But obviously, there are people who have long QT syndrome who are older, but it's much more common to hear about it in younger children. So if you have any questions, I will try to answer them as much as I can. I can't guarantee you that I'll be able to answer them right away, but I will do my best, and that's all I have to say. So I hope you guys are having a great day, and I will see you guys again soon.